to this month's episode of Recovery Rockstar. You'll probably note that this is the second episode in the month of September because September is Recovery Month. So not only have I chosen two guests that give us some access to different resources, but they still tell about their recovery journey, but because of the different resources that are available out there, I thought it would be really empowering to have people who work in the field in some degree tell their story and share a little bit about some of the resources out there. So I'm really excited to interview my guest today. That being said, my name is Melinda White. I am a person in long-term recovery. What that means to me is that I have not had to use a mood or mind-altering substance since December 28th, 2011. That is a gift. It is not my victory. It's the victory of those who have helped me through the path of recovery to navigate it. And more than anything, this show is about teaching people out there that there is hope, even when the situation looks hopeless. There's nothing more beautiful than watching somebody through their journey of treatment and recovery, and they make that subtle shift of trying to be the best in the world to trying to be the best for the world. The energy and passion that an individual has once they've seen hope and experienced it and tasted it, it makes them so driven that the masses that they can reach with their story is just unbelievable. So I'm, again, very grateful for another opportunity for us to get another story out there, to get a little bit more information out there about addiction and recovery. Recovery Month was very successful with various recovery walks and cookouts and a lot of different awareness events. So I'm really excited for the movement that the recovery community continues to have to share hope with those who may be broken or think that there is no hope. So I'm very excited to introduce my guest today. I think that we met probably about 4 or 5 years ago. Ed Baker is an amazing person. He has done some phenomenal things. I've gotten to see it firsthand, but I'm not going to share about it because I want to leave that to you. But first I want to say welcome.
Thank you, Melinda, and thank you for having me on your show, and thank you more so for your contributions to the movement.
Yeah.
You know, the recovery movement, and your introduction was just so spot on and so beautiful. Thank you.
Well, I'm super appreciative that you came here and that you're part of it. You're part of the solution. You're part of this movement. You know, it's exciting to travel the journey together, and whether we're people that see each other on a regular basis or just once in a while, it's almost like that unspoken, here's another family member ready to push forward. And it's just exciting because we know there's a solution. We know there's hope. We see it all the time. Some people who may not access more than the regular news or, you know, they don't get to see that. So I appreciate that you're coming and being able to share with us. So, you know, usually where I like to start is just kind of give me a little bit about yourself. What did your childhood look like? Where did you grow up?
I grew up in the Bronx.
Okay.
Morris Park Avenue, Bronx, New York. Was born in 1946. I was a child of the 60s, I guess you could say. You know, my teenage years and my early adulthood began in the 60s. I was part of a, normal American Catholic, very low-income family. Had 4 siblings. I was the youngest. Actually, I was thinking about that today on my way here. You know, you think about your history, and my closest sibling is my sister Billy, who is 10 years my senior.
Wow.
So I was very much an only child.
Right. So you were the baby, and
still am.
This is right. That never goes away. I'm the baby too.
We have that in common.
I know, we have a lot in common. So tell me what it looked like when you first had exposure to substances of any kind. Like, about what age did you get introduced to any kind of substances?
I was thinking about that today too. I think that I began smoking cigarettes probably at around age 12.
Yeah.
And that was my introduction to psychoactive chemicals.
Yeah.
And I didn't like cigarettes. I had to smoke cigarettes like intentionally because the value of being cool was more important than my own comfort.
Right.
So I smoked cigarettes until I got comfortable with it, which really means you develop, a tolerance to the effects of nicotine and the dependence on nicotine.
Right.
And that was my first, I think my first addiction was nicotine.
Yep. And that's interesting too when you were saying that, because when I look back for my personal experience and other people I speak to, it's not like that first puff off a cigarette is great. It's not like the first drink of booze is good.
Oh, yeah.
Tastes horrible, but we're going for an effect of some sort or for some kind of exterior pleasure. So it's interesting. I think you're the first person who's highlighted knowing that piece of it. Like, it wasn't pleasurable, but we keep doing it until it is.
Not by any means. And I did it until I developed a taste for it or tolerance for it.
Right.
And then had that piece done. Now I'm one of the guys who smokes.
Yeah.
You know, so I'm cool.
So as you move forward in your years, when did you see other substances that came in the picture? And I guess even before asking that, was there any specific thing that had happened that made you start reaching outside yourself more than the average experimentation?
Yeah. You know, you hear a lot today about, and accurately so, thank God, about brain disease. That addiction is a brain disease. And we look at the two main factors like genetics and environment. Yeah. Well, with me, I developed addiction, full-blown addiction. And I don't really think it had, there was not a lot of alcoholism or drug addiction in my family. Very hard to find. I don't really think there is any we can note except for me. I was the first one. For me, it was environmental. Tragically, and during my 13th year, so I was a little boy, smoking cigarettes. And tragically, my father died in his sleep, and he had a heart condition, and I found his body. And, you know, for a 13-year-old boy, I mean, this was overwhelming and tragic. I was filled with grief, pain, darkness, rage, you know, just filled. My inner world became intolerable. And I think psychoanalysts would call it double parent loss. I lost my father to death, and then I lost my mother to depression. And remember, it was just she and I in the home. So my home became an extremely painful place to be. It was unbearable. What I did was I hit the street. And then it became nicotine, alcohol, marijuana, and then a succession of other drugs. Hallucinogens, benzodiazepines, opioids, stimulants, the whole gamut of drugs. And while I found great relief in taking drugs with other people, under the surface in my brain, addiction was developing. And it took a few years to develop into a full-blown, all-consuming addiction that lasted 20 years.
It's interesting, too, when we look at what is it that a person may be addicted to. To some degree, I've seen some studies, too, that say if somebody is specifically addicted to alcohol, it could be between 20, 25 years and 45 years before they get to that point, because we know it's a progressive disease, but before they get to the point that they have decided that it's unmanageable and they need help, whereas when you have other substances, especially opioids, maybe 2 to 5 years is that span, and 5 is being pretty, I think, graceful. I don't see a lot of people that make it to 5 years of opioid use without starting to hit that bottom and recognize it. But it's interesting because that's what it sounds like you're saying too, is within, you know, a few years it's full blown.
I used opioids, but mainly my main drugs were usually stimulants and then sometimes mixed with opioids. I used drugs intravenously for a long period of time, and there were multiple times where with every cell in my body, I wanted to stop. I wanted to recover. I wanted to stop hurting myself and stop living the way I was living. And I would make wholehearted attempts and succeed for a while. But I never understood that I had a disease. And I always tricked myself, or my mind tricked me, my disease tricked me into thinking that I could somehow control my involvement and use in moderation. And I never could. I never could. It took me a very, very long time to understand that about myself. And I think that in general, because I'm from a different generation, I think back then we didn't have the kind of knowledge we have today about brain disease. So I was kind of receiving the wrong type of information. Just briefly, I graduated from a therapeutic community in 1973. I was in treatment for 2 years, and I excelled in treatment. I became a junior counselor, and at the end of 2 years, I was awarded live-out status, work-in status, and I was also awarded drinking privileges. So, and so I was rehabilitated from my intravenous addiction, and I was awarded drinking privileges. From 1973 to 1984, I developed full-blown late-stage alcoholism.
Right.
So at that point, 1984, was when I came to grips with this idea that I couldn't use any drugs because my inner world would always compel me to use in the way that's characterized by what we call addiction.
Right. You know, and it's interesting too, because when you were saying that you would have these attempts to stop, and passionate attempts, like we swear we're never going to use again, and yet you find yourself using. And I'd like to say, especially for family members out there, because I hear from family members that just don't understand why their loved one continues to use, and, well, they're lying to me. They said they were done, and then they used again. And I try to remind them that for the times that I know that I tried to quit, you could hook me up to a lie detector test, and I will pass, because with everything in me, I want to stop. And that's what I heard you describe.
Absolutely.
It's unfortunate that we don't have the ability, no matter how bad we want to stop, without the knowledge of what it is we're trying to stop and what we have to keep an eye on. We don't know how to without help. So it sounds like you had said that you had ended up going to a therapeutic community and seeking treatment, and yet there was still that kind of door open for a substance that's okay, the award of alcohol, so long as you don't use all the other stuff. That still made your disease progress. So what did it look like for you when you got to the realization that you could no longer use any substance safely? Where did you seek help next? What did that look like?
I developed what I would call full-blown alcoholism, and it was 1984, and I had, in the previous phase of my career of addiction, I was homeless. I was in San Francisco, Massachusetts, New York. There were many years where I didn't have any expectations of myself because I had the symptoms of addiction had dominated my life completely. From 1974 From 1974 to 1984, I got a BSW, an MSW. I became a master's level social worker. I got married. We had 2 children. I had expectations of myself.
Right.
The alcoholism was undermining my expectations of myself. So in 1984, I entered into counseling. And with an alcohol counselor, his name was Jimmy Cleary. And some people will remember him. He was a wonderful man. I think he was the first prevention specialist for ADAP. And he really helped me to see that alcohol had become like a killer drug in my life. I had great resistance to seeing that. I didn't want to see that. And he helped me to pierce through some of my defenses. I was minimizing it. I was rationalizing it. I was telling him about all the people I knew that were worse than me.
We're good at that, huh?
Getting the focus off me.
Yeah.
And he coaxed me into going into a controlled drinking experiment, which I did. And I controlled my drinking for a month. And it was excruciating to me. I didn't want to control anything.
Yeah.
I wanted to drink.
Yeah.
And at the end of that month, I was at wit's end, and I became capable of accepting help, and I sought the help of a 12-step program, and that was July 22nd, 1984, and I never drank again.
That's awesome.
I have had unbroken sobriety since July 22nd, 1984. I've had a program of recovery.
Yeah.
I've had instructions to adhere to a joyous, fulfilling, rewarding deep, all-encompassing recovery.
Yeah.
I've had peers around me. I'm surrounded by people in recovery.
Isn't it beautiful? Isn't it amazing?
I see it every day, and I live it every day.
Yeah.
I've had, my clinical career is over now, but I've had 3 decades plus of clinical work, psychotherapy with people with substance use disorder in my office, in a confidential setting where I can tell you that some of the most beautiful moments of my life have been spent in my office doing therapy with people, helping them to find their pathway to recovery. It's been an incredible journey, and it all began with my recovery.
Right. I can't, and it's so amazing to hear you speak of just your story and your journey and the unfolding and the help and the peers and being wrapped in it. And it becomes for us, I think, just a way of life. It's not whether we're working in the field, it's not a job, it's a way of life. Whether we're working our own recovery, it's not, oh, I have to do this, but it's a way of life. And there are so many amazing people out there that want to help people that are struggling. And you have developed this amazing series, and I'm excited because now I really want to touch on one of the clips that we're going to be showing where it's, a woman who works in the field. And, tell me just a little bit about that before we show it to our audience, that clip.
The first clip is from the episode on treatment.
Yep.
You have John Brooklyn, who's one of the architects of the hub and spoke system here in Vermont. Chris Laconis, who is the medical director at Gifford Addiction Medicine program, and Deborah Hopkins, who is the person in the clip. She is the Chief Operations Officer at Central Vermont Substance Use Services. And Deborah, I prompt her about a comment that she has made about sticking with them. She talks about sticking with clients and helping them to find their road. And this clip is just a gorgeous display of the compassion that so many people out there in the field have for people with substance use disorder.
We have to remind ourselves that it's their path and not ours. It's not about outcomes for a clinic. It's not about what my version of success is. We have to stay with them in the moment that they're in and recognize that nobody is going to be as difficult to them on a relapse or doing something wrong as they're going to be themselves. And I think when I said one of the things we try to offer people is respect, that we glass over that if we are professionals and we have jobs, but if we look at people on the street, when you've looked at a homeless person and looked them in the eye and say hello, you can see a brightening. Our folks are expected to be put down on a regular basis. And so we start with, yes sir, no sir, how are you today? We get to know them a little bit more as people, which helps bring their dignity up. And so that when they do have a relapse, they'll still walk through the door and know that we know them as a person and they just had a bad behavior. And I think that that is a philosophy throughout the state. I think we're seeing that there's, because first off, it's a critical mass. Everybody knows somebody who's affected by this in this community. Now that it's become less stigmatizing to talk about it. I'll admit, my son's baseball games became a family support time for me with at least 3 other parents who knew I worked in the field. You know what? That's the good work we can do now. And it isn't just with the people that we're serving. I think with the elevation the state has made in bringing up this issue and the stigmas around it and the preconceived notions that are false, I think it's really helped open it up to be the family, the community issue that in fact addiction is.
All right, so that's one of the clips from the 8-part series, and they're all amazing. I also want to ask, though, because the next clip that we're going to be showing, as we're looking at the recovery journey, oftentimes people may start off in a program of some sort, residential, and then there's, you mentioned peer recovery, even in your journey, and I know that's a huge part of my journey, is being surrounded by peers. So the other clip that we're going to be showing, that is where you're speaking to Gary DeCarolis, who is the executive director of the Turning Point of Chittenden County, correct?
That's right, yes.
And he's basically going to be talking about the miracles that he sees.
Yes.
Correct?
Yes.
So I'm really excited for that clip to come up, and we're going to show the audience. Would you like to say anything before we pull up the clip?
Just that, the miracle that Gary is talking about happens every day in all 12 recovery centers. And it's some of what we in recovery are privy toward being involved in, where the general public really does not see it. So this is like a glimpse that Gary gives the general public.
Awesome. So I'm really excited to have this clip shown as well, and it does really highlight some of the miracles that may not be seen to the public eye as often as they ought to be, but they're happening every day.
So they would be allowed to come into the center and just kind of sit around and be part of the community, but just feel it out until they achieve some level of comfort?
Yes, and in fact, many times, if you use the analogy of a flower that hasn't bloomed yet, people will come in, they'll find a little corner for them to sit, they'll grab a cup of coffee, and sometimes they just sit, literally, for days.
Yeah.
And then I'll watch them over time, and they make a little connection. Of course, our peer support specialists will have nudged their way into their life a little bit. And then you can see the slow opening up. You know, we have a couple employment consultants, and they might find their way over there too and see if they need any help with a resume or trying to deal with employment issues, or housing might be another big issue on their plate. They have computers in the center that they can use for these things as well. And over time, you see them open up a little bit more, a little bit more. Then they might want to become a volunteer themselves after a couple months. And then that's a whole cadre of people that support each other on top of all the other stuff that we got going on. And then comes the big day when they maybe venture out for that first employment interview. Wow. And we've got someone there that's going to be looking forward to hearing how it went when they come back. And these things build on, and you can see in a good 3, 4, 5 month period of time a transformation take place. They have hope, which they might not have had when they walked through the door. Yeah. They have a sense of self that they might not have had when they first walked in. They might have gotten involved with our yoga program or meditation or a number of things that we offer. We have over 250 meetings a month in our center of all sorts. And so you can see they're engaging with life again. That's what happens after a period of time.
Yeah. Ed, I'm going to ask you just to give a little description of what this 8-part series that I'm alluding to, what is it?
Yes, it's very exciting, Melinda. Governor Scott, with his second executive order of 2017, put in motion the Opioid Coordination Council. The Opioid Coordination Council developed recommendations that are being rolled out. This 8-part series describes the pillars on which the governor's program to deal with opioid use in Vermont stands. Basically, there's a segment on brain disease, a segment on treatment, recovery, prevention, and law enforcement, then 2 expansions on treatment, which are co-occurring disorders and wellness, and then a wrap-up session. So it's a comprehensive view for the public. We speak in general terms. There's no big scientific terms. Mm-hmm. It's all information delivered completely with compassion to educate the public, raise consciousness, and dispel stigma, releasing really the compassion that we feel for each other. People feel compassion normally. Stigma has been created by misinformation and fear. This is to pierce through misinformation and fear and touch people where they live, in their hearts, so they can release that compassion for fellow Vermonters with opioid use disorder and other substance use disorder who are dying. We need to save lives.
Oh, I love that.
Yeah.
You know, when I first heard about the series, it warmed my heart. And as I've, seen the clips and then having you here to share about it and knowing that it's going to be widespread. And the underlying goal is we want to help lives. We want to help people save their lives and help others, and for an overall healthier community.
Yeah.
So, Ed, I really appreciate you coming on the show. I appreciate what you shared about your personal journey. There's so much hope, when you talk about some of the stuff that you've gone through and where you've been, and look at where you are today. And I know for me, as well as anybody else who's been on the show, that there is hope, and we may not see it, we don't see it with the human eye right off, But because we believe, you know, and I often say in a society that says, I'm not going to believe it till I see it, you got to believe it to see it. You got to believe the miracle can happen to see those miracles. And once we get that shift, we see it all around us. So, you know, to all the people who are watching, I really hope that you are encouraged and that you know that there is hope out there. There are a number of resources in the state of Vermont. There are, as Ed mentioned, 12 recovery centers in the state of Vermont. You can look on the Vermont Recovery Network website. You can look up each center individually. We've got inpatient residential treatment. We've got outpatient treatment. There's a hub and spoke model. I encourage you to look at the health department for different resources as well. There are so many options out there for a person seeking help. And if anything, just know that any of us that share our stories, if you would have isolated one day out of our life before we got into recovery, you would say, that person's not going to live to see the next month. People do recover. So I thank everybody for watching, and we'll see you next month on the Recovery Rockstar Show.